When we say the body is improving in one sense, it could certainly be due to an improvement in the function of the autonomic nervous system itself. However, the autonomic nervous system is also often involved in helping stem cells be released from their storage sites into the bloodstream and ensuring those released stem cells function properly. Therefore, I believe there can definitely be a synergistic effect. And there are indeed some international papers and scholars who discuss this in a similar vein. Autonomic dysfunction presents a very wide spectrum of symptoms, ranging from mild ones to truly debilitating ones, and even extending to symptoms that can make a person feel like they want to give up on life. So when that happens, we typically try various things. We take medication, we try to manage it on our own, and we receive treatment at a hospital. For most of the patients who come to our hospital, well, as we proceed with treatment, about 7 or 8 out of 10 people will gradually see improvement. For those who do improve, most of them don't necessarily need to undergo stem cell therapy. But for the patients who don't see improvement, it can feel truly hopeless. These individuals often say, "I don't think I can go on living like this." They ask us if there are any other treatments they can try. It's because of the needs of these patients that we began to consider other treatments. You see, we had been selectively performing stem cell procedures on cerebral infarction patients because the effects are quite clear for cerebrovascular diseases, especially for strokes. Now we are applying it to other neurological diseases and even to severe cases of autonomic dysfunction. Of course, we also use it to improve immune function, reduce fatigue, and for skin and hair loss issues. But for patients who are truly struggling, I believe autonomic dysfunction can be a very good indication for this treatment. When patients with severe autonomic dysfunction consider stem cell therapy, rather than just suggesting, "Let's start with stem cells right away," we first need to determine how much the stem cells will actually help the patient and whether they can truly be effective. There are several ways to do this. Of course, these aren't methods mentioned in textbooks. Rather, this is my own opinion based on my clinical experience and inferences from various papers and literature. Since this is an extension of the autonomic nervous system treatments we already perform, and since there's virtually no harm to the body, I personally believe it's better to try these pre-treatments or therapies first and then consider stem cells. However, just as the effects of stem cell therapy can vary widely from one patient to another, the results of stem cell therapy for patients with autonomic dysfunction can also, of course, be quite different for each person. So, to predict these effects to some degree and to achieve the maximum result with just 1 or 2 treatments, we perform certain tests, procedures, and simple therapies before the stem cell treatment. However, these methods are, in a way, part of our hospital's specific know-how, so I'll refrain from detailing them here. For a person whose body recovers through such pre-treatments or autonomic therapies, I believe it's more accurate to say that the function and activity of their stem cells have improved, rather than just the number of cells. And in my personal experience, it is in these cases that we see a greater synergistic effect when we actually perform the stem cell procedure. So, how exactly do we utilize the stem cells that are produced? Let's take bone marrow as an example. Bone marrow has traditionally been considered the source of stem cells, and it's been researched for a very long time. So I'll use bone marrow as the basis for my explanation. The bone marrow produces a variety of stem cells. There are hematopoietic stem cells, mesenchymal stem cells, vascular endothelial cells, and neural stem cells. For these stem cells to be used by the body, they have to be released into the bloodstream. In other words, they have to move from the bone marrow into the blood vessels. And in the bone marrow, stem cells need to mature and prepare for release. And there's a nerve that is involved in this process. This nerve is the autonomic nervous system. The interaction between the sympathetic and parasympathetic nerves plays a role in ensuring that the stem cells in the bone marrow function well, mature properly, and are effectively released into the bloodstream. So, when we perform treatments that can predict and improve the function of the autonomic nervous system, the body's improvement can, in one sense, be due to the enhancement of the autonomic nervous system's function itself. However, the autonomic nervous system is also involved in helping stem cells get released from their storage sites into the bloodstream and ensuring that these released stem cells function properly. So, if the body improves through autonomic nerve therapy because the function of the stem cells already in use in the blood is enhanced, then if we were to collect concentrate, and ideally culture the stored stem cells that aren't currently being used and re-inject them into the bloodstream, I believe we could certainly see a synergistic effect. And there are some international papers and scholars who discuss this in a similar vein. So while I can't definitively state that this is because of a specific reference, when I consider it based on my own experience and the opinions of these international scholars, it seems we can surmise that the function of the autonomic nervous system can predict and regulate the function of stem cells and even enhance their effectiveness. When we perform stem cell procedures on patients with autonomic dysfunction, we see a pattern of change that's a bit different from the typical case. It's not so much interesting as it is a unique phenomenon. And what that is, first, once stem cells enter the blood vessels, they travel throughout the entire body. And it seems the first place they go, or the easiest place for them to reach, is the skin. Even among patients treated for autonomic dysfunction, some who received stem cells because their symptoms were so severe have said things like, "My body hasn't improved yet, but my skin has gotten so much better," or rather that their skin has improved. And they say their hair loss has decreased. So people around them comment, "Your face looks so much better, but are you still in pain?" I've had some patients who hear things like that. But what's clear is that for people whose skin, scalp, or complexion improves, their autonomic nervous system function also tends to improve over time, and we've seen this in practice. The reason is when stem cells go to the skin or scalp, it means they are highly active and that the body is ready to accept them. And since the skin is on the surface, it improves first. But over time, this can also mean that the stem cells are definitely reaching the gastrointestinal tract or the musculoskeletal system. So for those whose skin improves, you can assume that even if it takes time, their autonomic nerve function can also get better. Of course, for those with more severe conditions, it's actually more common for them to need 2 or 3 treatments rather than just one. Still, by observing the skin's response, we can predict to some extent the changes in internal organs. In patients with dysautonomia, there seems to be this unique tendency. You might ask, how severe does it have to be to get stem cell therapy? In truth, it's not easy to quantify and objectify the state of the autonomic nerves and say, for example, that a score below a certain number is severe and a score above it is mild. That's because of the nature of the autonomic nervous system itself, so the standard for what's considered very difficult can be quite subjective. But the standard I use is when someone feels, "I really can't live like this. I'd rather just die. My life is too miserable," or "I can't live a normal life." I consider that to be a relatively severe case of dysautonomia. And for those individuals, I explain that stem cell therapy can be helpful on a limited basis. In conclusion, my view is that there is no diagnostic medical device, no diagnostic method, and no judgment criteria that can objectively quantify and tell you whether you need stem cells or not. The reason I'm mentioning this cell therapy is to briefly explain that it can be considered an alternative, a treatment concept for areas that new or existing therapies haven't been able to cover. Current treatments certainly have their limits, but if these therapies are further upgraded and developed in the future, I believe a day will come when we can achieve even better results. Don't give up, have hope. The moment you give up, the autonomic nerves in your body and the more than 30 trillion cells in your body also give up. If you approach it positively, with the will to overcome it and the belief that you can, then the 30 trillion cells in your body and the autonomic nervous system that controls them will also gain strength. Keep fighting. Don't give up.